This session of Nursing Informatics will focus on discussions related to knowledge and information science. At the end of this session, you will be able to explore how knowledge is generated in information science and define nursing informatics in its relation to various nursing roles and care delivery. The building blocks of nursing informatics are nursing, information, computer, and cognitive sciences. Nursing science is defined as the ethical application of knowledge acquired through education, research, and practice to provide services and interventions to patients so as to maintain, enhance, or restore health, to advocate for health, and to acquire, process, generate, and disseminate nursing knowledge to advance the nursing profession. Information science is defined as the science of information, studying the application and usage of information and knowledge in organizations and the interfacings or interactions between people, organizations, and information systems. Computer science is defined as a branch of engineering or application of science that studies the theoretical foundations of information and computation and their implementation and application in computer systems. Cognitive science is defined as an interdisciplinary field that studies the mind, intelligence, and behavior from an information processing perspective. If you imagine that you are in a social situation and someone asks you, what does a nurse do? Think about how you will capture and convey the richness that is nursing science in your answer. The focus of nursing is on human responses to actual or potential health problems and advocacy for various clients. Nurses must possess the technical skills to manage equipment and perform procedures, interpersonal skills to interact appropriately with people, and cognitive skills to observe, recognize, and collect data, analyze and interpret data, and reach a reasonable conclusion that forms the basis of a decision. Nursing is an information-intensive profession. The steps of utilizing information, applying knowledge to a problem, and acting with wisdom form the basis of nursing practice science. We acquire data and information in bits and pieces and then transform the information into knowledge. One of the most frequently quoted and widely accepted definitions of nursing informatics is that it is a combination of nursing science, information science, and computer science. The readings will focus on nursing science as one of the building blocks of nursing informatics, although the text includes the traditional definition of nursing informatics to include cognitive science as one of the building blocks. Individuals have an amazing ability to manage knowledge. The ability is learned and honed from birth. We experience our environment and learn by acquiring, processing, generating, and disseminating knowledge. The Foundation of Knowledge model in 2007 is the organizing conceptual framework of the readings and tie the model to nursing science and the practice of nursing informatics. This model helps to explain the ties between nursing science and informatics and knowledge. Informatics is viewed as a tool for founding knowledge. The American Nurses Association 2003 defines nursing in this way. Nursing is the protection, promotion, and optimization of health and abilities, prevention of illness and injury, alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of individuals, families, and community, as well as populations. We are knowledge managers, capturing and processing collective expertise and distributing it where it can create the largest benefit. We are knowledge developers or generators, changing and evolving knowledge base on the task at hand and information available. Knowledge must also be viable. Knowledge viability refers to applications, most technology-based, that offer easily accessible, accurately, and timely information obtained from a variety of resources and methods and presented in a manner as to provide us with the necessary elements to generate new knowledge. Knowledge variability refers to technology-based applications that offer easily accessible, accurate, and timely information obtained from a variety of resources and methods, and presented in a manner as to provide us with the necessary elements to generate new knowledge. All nurses have the opportunity to be involved in the formal dissemination of knowledge via their participation in professional conferences, either as a presenter or attendee. All nurses, regardless of the practice arena, must use informatics and technology to inform and support that practice. Wisdom is the application of knowledge to an appropriate situation. In the practice of nursing science, we expect action and/or actions directed by wisdom. Wisdom uses knowledge and experience to heighten common sense and insight to exercise sound judgment in practical matters. It is developed through knowledge, experience, insight, and reflection. In order for nurse educators to be effective, they must be in the habit of constantly building and rebuilding their foundation of knowledge about nursing science. Nurse researchers must acquire and process new knowledge as they design and conduct their research studies. The future of nursing science and nursing informatics is intimately associated with the nursing education and nursing research arenas. SCIVA 2007 suggests that we need techno-savvy and well-informed faculty who can demonstrate the appropriate use of technologies to enhance the delivery of nursing care. Informatics and the use of technology in the practice of nursing are equally important in the nursing research arena. Participants in the development of the National Nursing Research Agenda, NNRA, identified these two technology-related priorities among other research priorities for nursing research. The first is the nursing informatics enhancing patient care. Second is the technology dependency across the lifespan.